Hi, my name's Dr. Ross Hauser, Medical Director of Caring Medical Regenerative Medicine Clinics. We're here in the Florida office with Donna from England. And Donna, you came in just to say thank you because we had treated you in 2017. So we treated you basically 14 months ago, and you just came in to give the Caring Medical staff a card, and you wrote here, thank you for giving me my life back.
I did.
And I just want to go through your original history. So I'm just going to read from the chart, and obviously you can put things in. And part of why we wanted to interview you was that there's lots of people who get diagnosed with alar ligament injury, and they don't realize that the type of prolotherapy specifically that we do at Caring Medical Regenerative Medicine Clinics can actually cure them of all their symptoms. So your story is indicative of other patients that we see here. Now, you were in a very bad whiplash injury in 2013. You had gotten osteopathic treatments, physiotherapy treatments, chiropractic medications, which I'm assuming was in England. And then you had, pain, obviously horrible pain in the neck, especially on the left side. You would get, zingy pains, disabling pains down the left side. Your symptoms were pins and needles, jaw pain, headache, earache, fatigue, sickness, toothache. Feels like being punched in the face. Feels like somebody stabbed me with a knife in the upper back. If you were to go for a walk, that would increase the symptoms. Throughout the day you would have to obviously lay down. You would turn your head and there would be cracking. And you said to us, feels like there's nothing inside in my neck that's supporting my neck and head. You had whole body aching. You felt like someone was twisting nerves in your neck.
Yeah.
So would you like to expound on that? And then why did you end up coming to Caring Medical Illinois or Caring Medical Regenerative Medicine Clinics?
Because I'd come to America and I'd had my DMX done with John Postlethwaite. He got me in touch with a guy called Christian Alar in London, and he was treating me, doing shockwave treatment and laser treatment, and he was helping. And he was lining my spine back up again every couple of weeks. Sometimes it wouldn't even last that long. It'd go out of line again. And he told me that I needed prolotherapy. We tried going to Milton Keynes, and he said that he could do from C3 to C7, but no one in the country would do from C1 to C3 because it was so dangerous. And I'd been to that many practitioners, clinic people, hospital appointments, and nobody would help. They're basically saying there was nothing wrong with me. So I looked up this place on the internet and I got in touch as soon as I could. And I realised that this was my only hope. I was in a really bad way. I'll tell anybody that even yesterday when I came in to visit, if I hadn't have come here, I'd have probably have done something stupid, because my whole life had been taken away over the 5 years. It just got worse and worse and worse.
You're saying you might have killed yourself or something?
I probably would have done.
Okay, and then what was the symptom or symptoms that had gotten you to a mental state where if somebody doesn't help me, like I'm going to end my life? Like that's how bad it was.
I think as well because no one was listening. And they didn't know what I was talking about. That didn't help because I felt like I was going crazy. And because my body during the day, I'd get up and I wouldn't sleep properly. I'd be waking up with twisting pains in my neck, like someone was twisting my nerves. They were sharp. Whichever way I lay, I couldn't get comfortable. I was waking up 3-4 times a night, and then I'd be up during the morning, and by the middle of the morning, after I'd probably made myself a cup of tea after shaking with my arm because I had no strength in my upper arms, I'd have to go back and lie down again because I felt like there was a load of pressure on my neck, which obviously was my head, and there was nothing there to support it, so it was just going all through my body. The aching, the jaw ache, the toothache, it was just debilitating. And it got to a point where I was so depressed because I couldn't do what I wanted to do, and everybody else's life was going on around me, that I just felt worthless. And
could you not work? What was your work?
I was working in an office at the time, and because I had a job to move my left arm out and I couldn't answer a phone and things like that, they did get me equipment at work, but with sitting there and having the weight of my head on my shoulders, after a little while I just couldn't sit. I had to lie down, and that was the only way, and to go to sleep was to take away the pressure.
Did you have dizziness or balance trouble or
I'd get
ringing in the ears, anything?
I'd get up and I'd feel like I was going raw, and it'd take me a few moments to adjust, and sometimes I did have to sit back down.
Okay.
I did have a lot of buzzing in my ear. Every time I chewed it, my jaw would click. I'd only have to turn slightly one way and my neck would crack. Even my joints in my upper body would crack when I'd move my shoulders or anything. I'd get stabbing, sharp, aching pains down my left side into my hand. My hand would swell. It just got to the point where I thought, you know, it's not worth being here.
Did you have headaches?
I had very bad headaches.
Yeah, explain those.
They were all clustered at the back of my neck at the top, and it'd creep across the top of my head. My head was sore all the time, like it had been burnt. I'd run my fingers through my hair and it'd be so sensitive. But I think because the main area at the back of my neck here was so sore and tender all the time from the weight, it just needed to be laid out sideways.
And then, you know, I had seen you, and we obviously did another digital motion x-ray which showed significant C1, C2 instability, but it also showed some significant instability, like from C1 all the way down to C5. So it wasn't just an upper cervical problem. And then how would you describe the care that you received at Caring Medical, and then how have you been since that care?
It was very scary when I came here, because obviously you said to myself and my husband that I may have to have my neck fused. You didn't know whether you could help, but you did. And obviously I kept coming back for the treatment, and over the process of that I did see some improvement after the first couple of sessions. It was very hard, but you were all amazing and so caring, and I even remember the first time when I had it, all I wanted was my dad, and I just burst out crying, and it was scary. And you know, because I'm so far away from home as well, you haven't got your own comfort, so I was in a strange country too, but you made it so worthwhile, and you really did help. And the aftercare from leaving the clinic, you were constantly on the phone, emailing me, asking me if I, you know, how I was. You gave me medication. You put me on the right track to recovery. It did take a while when I got home. It was very hard when I went back to work because they were still horrible to me. They said that I chose to come and have the treatment, so, you know, on your head be it. But it was, people get to the stage where if I don't try it, I'll never know. So I took a very, very big risk in coming here and putting my life in your hands. And I really do truly thank you for it.
So obviously at some point you knew you were going to get better. Like obviously you came here to thank us, like just to thank us. So when did that happen? Like you actually knew that?
I started doing different things when I got home. My biggest hurdle was my granddaughter. She was born the end of December, and I was so scared that I was going to drop her. And I'd said to my son, you know, if it gets to that stage, please take her off me because I don't feel safe.
How old was she? Or how old?
Newborn.
Okay, good.
But it was the fact of looking down at her and trying to feed her. It was the twisting of the neck and everything. That did bother me for a little while. I mean, I love her to bits and she's my world, and it got to the stage sometimes I'd constantly have her for myself during the day, but I'd get so upset because as the day went on, I was scared that I got so tired in my upper body that I was going to drop her, so I had to take her home, and it did upset me. But as time went on, I started doing more around the house. I got more mobile. Even my attitude and how I felt, it was I felt guilty because I didn't feel poorly anymore, and I'm like, this doesn't feel right, this is not me. And I think after a while it just blended from one day to another, and it just got better. I mean, we've moved house, I was lifting boxes, I'd do a little bit and then I'd get tired, and I knew that the next day I'd probably do a bit more. We moved house, I've painted ceilings, I ride my bicycle now, I've got a new job, I'm more mobile, I can do 100% more than what I could have done last year, and I never thought I'd ever do those things again.
And then, you know, I haven't treated you in 14 months,
Yeah.
right?
I know, it's been so long. I do realise that I will have a soft spot at the back of my neck where I probably will get the odd niggle, because it's weak. But as time goes on, obviously I'm hoping it will get better. And I do travel in the back sometimes in the car, and I do have little issues. It makes me tired, but I think that's mainly because I still need that bit of stability.
Yeah.
For the back of my head, and I do use my pillow sometimes and that, but I know what to do, and it does tire me out a little while, but it's well worth, because I know the rest of the day I'll be fine, and it's very, very rare, and it's disappearing as time goes on.
After the prolotherapy, what symptoms don't you even have anymore?
I don't get headaches, I don't get the sharp stabbing pains, I don't get the muscle pains in my thorax. My arm doesn't ache, my hand doesn't swell. I'm a totally different person. It's like none of that even existed anymore.
And then you'd say you pretty much have a normal existence now, like you have.
It's like it never even happened.
Yeah. Like
it's weird.
Yeah.
Like I say, I feel guilty because I can't remember that part of my life. I don't want to, but I know that it did happen, and you know.
So say somebody, you know, let's say we put this on YouTube or some channel, and then somebody's watching it, then what would you say to them, like if they're suffering from headaches, neck pain, you know, horrible dizziness, ringing in the ears, migraine headaches, you know, especially if it was
Yeah.
after a trauma or a whiplash?
Yeah,
Like,
if things like that carried on and they were getting nowhere with their doctors and their clinics and appointments, to definitely look up this place on the internet or get in touch, because I'm 100% sure that you would be able to help them in one way or another, and possibly cure them of what they're suffering, because I know it's not nice to be in that situation, and they're not alone. There's somebody out there that can help, and you've sat right here beside me. So do it. Please get in touch with the clinic.
Thank you.
You're very welcome.
Thanks.
Thank you.
Thank you. Thanks for coming by.
You're welcome, and thank you so much.
Okay.